in the morning, in the morning, in the morning, I will rise and praise. Oh, it is raining all around me. I can feel it. Oh, in the light of rain, I ask Jesus to give us more rain. Until we are so, and we are so in the light. Oh, it is raining. It is raining all around me. All around me, I can feel in the light of rain. Oh, in the light of rain, I have Jesus to give us. Oh, hey, Baba, and so we are so, and we are so in the. Oh, chebe me nyakupo, chebe me nyakupo. Oh, chebe me nyakupo. Ah, chebe me nyakupo. Ah, atiti chebe nuda. Ahunto musu chebe. Oh, enkwa woni mo me nyame chebe nuda. Chebe me nyakupo. Ah, puma dada. Puma dada. Oh, mere Yesu be me puma. Puma brada. Ah, mere Yesu be me puma. Ah, oh, puma. Dada, puma. Dada, oh dada, mere Yesu be me puma. Puma dada. Oh, mere Yesu be me puma. Da. Kotoje. Oh, kotoje. Oh, bekoto techema. Ema ma bekase. Oh, me se yami yo. Oh, you're right. Kotoje. Oh, kotoje. Oh, bekoto. Ema ma. Ah, oh, me se yami yo. Era. Orura, me si madiswa, e moi ye du, me to me swa madiswa e, awo meja e so mi moda, awo meja e so mi moda. Well done. Alright. Awo meja e so mi moda. Oh, nanka me yeden amakoso. Soro hima madiswa. Emwae do me to me swa madiswa. Awo meje so mi moda. Oh, nanka me yeden. Soro hima madiswa. Emwae do me to me swa madiswa. I'll meji so me mura. Oh, this is the way I wanted to be. I can't hear you. I tried it. Oh, this is the way I wanted to be. Oh, I wanna be empty. Oh, I wanna be empty. Hey, I wanna be empty. This is the way I wanted to be. Oh, I wanna be empty. Oh, I wanna be empty. Hey, I wanna be empty. This is the way. Oh, bana hiba. Well done there. Oh, bana heba. Ibana o. Ibana e. Ibana o. Hey.
Thank you very much. Thank you. On this important note, I believe our morale is high now. May I now call on Reverend Dr. Daniel Opuni to give us the opening prayer for the morning. Please join us together as he comes. Thank you.
Please, respectfully, can we be on our feet as we share a word of prayer? Let us pray. Our gracious Father, we thank you for the gifts of this day, how far you brought us as a society. We want to thank you for this second Emergency Medicine Society of Ghana conference, and we thank you for this third day and the last day. We commit all our activities today into your hands. We pray that your presence will be with us and make it a success. And we begin today's session in the name of God the Father, God the Son, and God the Holy Spirit. Amen.
So, just as we did yesterday, we are going to recap yesterday's events, and in this order, we are going to show a video of the events that happened yesterday. If our team is ready, can you start showing the video, please? Thank you very much. Thank you so much, the Touch Videos, for a very wonderful video. So we'll begin this morning's program with our women in EM presentations. And I'll be calling on the very first person to present very soon. Our very first woman in EM who is going to be speaking about women in EM care, women in emergency care, breaking barriers in leadership, our very own LOC chair. Maybe please welcome Dr. Enobaini as she begins her presentation. Forward and back. Okay, fine. We are forward, we are back.
Good morning. Unfortunately, we have just a few ladies here. But I'm sure the men will help us. Because you need to listen and help us. And we apologize for not having this program yesterday. I'm sure a lot of the ladies came in yesterday because of the schedule for this particular program. As we all know, our healthcare force is made up of about 70 to 80% of women everywhere in the world. But look at the picture over here. If you count about 6 people, you find just one gentleman. But when it comes to the leadership positions, this is how the picture looks like. So we are going to discuss some of the barriers that hold the women back and see the way forward as we move on. First of all, we'll talk about who a leader is. A leader is somebody who is visionary, empathetic, decisive, has a very good communicative ability. You should be resilient if you're a leader, and then you should be able to empower others. And you have to be authentic. Fake BNM. You have to lead with integrity, honesty, and transparency. Some of the challenges that women face as they try to get into leadership positions may be limited opportunities for advancement. In terms of, we all know there are lots of barriers associated with women trying to climb the ladder. Even if there's any advancement course, some of us may not have the opportunity due to the pressures of life that is peculiar to just women. Work-life balance. If we want to talk about work-life balance, we are going to spend the whole day here. You work with your colleague. You may even be married to that colleague. You all have the same schedule at work. You are expected to do a lot of things at home at the same time. Meanwhile, you're expected to perform the same way your colleague is performing at work. Inti man pressure no de. The work-life balance is one of the major things holding us back. Even if you take up a leadership position, you may end up be a once in a while, family things may come in, you have to ask permission, and then you are seen to be a lazy leader or something of that sort. Pregnancy may come in. All these things are some of the barriers that hold us back. Lack of mentorship and sponsorship. Most of the time, even when there's a scholarship at work, maybe they want just one person to go and learn to be a paramedic. Even though the men are few, they will consider the men first before they think about a lady. And then getting the right mentor. Most of the ladies still have males as their mentors. Meanwhile, we have peculiar problems that some of our ladies may be able to encourage and help us with. Cultural barriers. They can hold it against you. And meanwhile, they don't even know what you are capable of. Sometimes in certain places, a woman cannot go ahead of the men, even though they may have the right qualifications. Because in a setting, a man is expected to lead. All those ones are some of the barriers that hold us back. It's part of your titles, because you have to put everybody in shape. And as you try to put the men in order, you'll be seen as somebody that is disrespectful. So that is part of the issues that we have. Social expectations, I've already mentioned some of them. If you're a woman and you want to climb the ladder, sometimes you may have to hold on with societal expectations. 27, you're expected to marry, have children. You've started a PhD. You don't have the time. You have to hold on a bit with some of the societal expectations. Meanwhile, it's not every woman that wants to get married. Yes. It's not everybody that wants to have a child. By force, if you're a woman, they will use all that against you. So those are some of the barriers that limit us. You can see a woman climbing a ladder. She's in her high heels, but she's still trying to do so. So if you're a woman and you want to break some of these barriers, you have to be emotionally intelligent. Know thyself. Know yourself. I'll use myself as an example. I can be very erratic. I can move from being calm to being aggressive. I can swing from 0 to 100 within the shortest possible time. You'll be surprised. But as I'm trying to go up, these days I'm learning to be calm. When I'm getting upset, I just walk away. So one of the first things you have to do is to know yourself. Because if you don't know your limit, it will be held against you. Yes. As you are going for a leadership position, you have people gang up, go and tell stories about you and all that. So you have to be emotionally intelligent and strategic as you plan to be in a leadership position. And you have to build a good network. You should have people who are helping you to climb the ladder as you move up. You should be a strategic thinker. Calculated risk. As you are doing everything, you have to plan well, see all the risk involved, and know how you are moving ahead. And you have to develop a very strong brand. I'll add every aspect of it. You should have a good sense of fashion. If you are not fashionably inclined, I'm suffering. You should get help. We all have friends. That's why you should have a very good, strong bond, so that some of the times, as the psychiatrist told us, you should have people who check you and put you in line. Your brand should speak in all aspects of it. You have to work on your fashion sense, your speech, everywhere you go and how you dress up as somebody who wants to be a leader. You have to seek mentorship. You seek mentorship from your seniors and your juniors as well. And you have to be resilient. You have to be hard in every aspect of the word. You hear all sorts of things, but you have to press forward once you know where you want to go. And you should be able to negotiate for opportunities. You don't give up easily. You negotiate for opportunities everywhere you go. And one important thing is you should learn to empower others. You don't hold on to power. Yes, somebody has to take over from you. So you should try and empower others. And have a collaborative mindset. Teamwork, which is one of the main aspects of emergency medicine and emergency care. You can't work without the other team members. There are a few women who have made it sort of as, we can take them as role models. The past president of International, the IFEM, International Federation of Emergency Medicine, was a woman. The whole world, Federation of Emergency Medicine, that's made up of the doctors. She was a woman, a very smallish woman. Oh, yeah, hard. She could control the whole world, all the emergency physicians in the world. She's handed over to a man, but the man has handed over to another woman. Even though the women may be few in that field, is like more than 60% of the leadership has been women. We have the American College of Emergency Physicians is led by a woman. Some of the presidents in the world. The latest one is the Tanzanian mafia female president. She's doing what some men couldn't do, killing people left, right. I'm not supporting her. Because of her, we may not be able to go to Tanzania next year. So I'm very angry with her, but she's taking up leadership position. We are praying that she will do better than what she's doing now. Call to action. Women in emergency care, it is time to take the lead. Michelle Obama said, lead by example and hope, and never fear. Leadership is about making others better as a result of your presence and making sure that the impact lasts in your absence. And yes, then you are not a good leader. When you are not there, the people should be able to say that if Asumasi was here, this is what she would have asked us to do. So we are going to do exactly that. That is the mark of a good leader. In emergency care, great leaders stay calm under pressure. They think critically and prioritize patient safety. This is something that we all have to consider. In conclusion, women remain underrepresented in emergency care leadership roles. And their presence in the workforce, even though it's significant, we are not the main leaders in the field. But as we said, it's mainly because of the barriers that stop us in the way. We've already mentioned most of the barriers. The greatest leader is not necessarily the one who does the greatest things. He is the one that gets the people to do the greatest things. This one is from a man. I wish I had a good one from a woman. Yeah. It's one of the past presidents of the United States, Reagan. He made this statement. Thank you very much.
Thank you very much, Dr. Baini. Our next presenter is Ms. Henrietta Into. She's an emergency nurse specialist and a member of the Ghana College of Nursing and Midwifery. She holds an MPhil in nursing as well as a Bachelor of Science in Nursing from KNUST and a diploma in emergency nursing from University of Michigan. She's an adjunct lecturer of KNUST and currently working as an emergency nurse specialist at Konfanochi teaching program and a senior resident in the fellowship program of the Ghana College of Nursing and Midwifery. Please welcome Ms. Henrietta.
All right. Um, I'm speaking on women in emergency medical care, leadership and equity in nursing. Right. Okay. So that's the outline of the presentation. All right. As a form of introduction, right, we are saying that women play an increasing vital role in emergency medical care, yet remain what? Underrepresented when it comes to leadership roles. And as Eno said, globally, we have 70% of the workforce being women, right? But 25% of the leadership roles is being taken by men. So imagine, the men are 30% and they are holding 70% of the leadership position. And women who form majority of the workforce are taking 25%. Right? So if we should put the leadership role or allocate it proportionally, like just some mathematics, right? Like men and women, mathematically or proportionally, it means what? So there is a paradox, right? And I'll call that paradox XX paradox. So we are set to find what? The X, right? Women, are we here? We are set to find the X. So what is preventing women from taking up leadership roles? Yes. The what? I can hear a whole lot of things, right? In our tradition, they say, Obadie, emema kasa onyede. But we are going to break boundaries, and we are breaking it. Eno gave a lot of examples, right? All right. So statistically, in fact, I couldn't find figure statistics like percentages when it comes to women. I couldn't say 20% of leaders are, women leaders are in Ghana. I couldn't find anything like that. But studies showed that there is significant underrepresentation of women in leadership in Ghana. And I think we can all attest to that fact. So just cast your mind around, right? How many women are CEOs of health institutions in Ghana? Any of, none. Okay, please, let's come down to medical directorship. Any woman, she stepped down. You understand the But invariably, we have some women in regional directorship roles in Ghana now. So I think we are doing better. But comparatively, we are still what? Way underrepresented. So relative of nursing leadership, what is going on? Globally, women face something that we call glass ceiling, right? So it blocks their access to highest leadership positions despite their strong presence at lower levels. So we find women who are doing well, but there is something called glass ceiling. It's not formal, it's not written, but it's there. And we can talk about what? Stereotyping women, right? Obadi or koyede oho. Obadi, did she work to get there? She had favorites, right? And it's everywhere in the system. So it's not formal, it's not written, but you can't get to the top. Okay, so the picture, you can see a woman trying to climb the ladder. It's not working. A woman trying to climb the ladder. There's a ceiling there. So she's trying to go up, but something is blocking her way to get to senior decision-making role. So you can see a woman climbing the stairs. Up there, you can see the men there, already sipping champagne. Right? You can see 2 men here. Yes. Sorry. They are there. You can't see them. their legs, right? They are hugging each other, right? They got there so easily. Although they were on the same level with the women, hardworking, ambitious, visionary, and everything. She was on a maternity leave, eh? Yes. So we have this glass ceiling blocking the way of women into higher decision roles. So Eno mentioned this. There was a staircase there, and this is called the broken rank, right? A phenomenon where women who are doing well, they are being promoted. Akakakrana will do highest position, there is a drop-off. It means that when you are a woman, you will climb, but you get to a point, it's what? You hand over to the men, right? So that place is set up for men, but not women. Although you have all the capabilities, you have all the abilities to do what men are doing. So we call it the broken rank. So we can see the man, he's just going. And the woman, they were on the same level, skills-wise, hardworking, ambitious, everything. But you see the woman, all now, no one there is what? Is broken. So it means what? You can't get up there. And the other women are following suit. We are waiting for you to get there so that we follow. But it's broken, so they are stuck in there. Yes. But there is this one. These are the Margaret Thatchers, the Tanzanian women, and all that, right? The ladder was broken, but what happened? So that's what we are saying down, that we won't sit down for the world to move without us. We need to do what? Go the extra mile. Because so our society or our culture has placed us in some position. We need to redouble our efforts before we get ahead of the men, our husbands, right? All right, so as I said earlier, traditionally, we have positions for men. If you are a woman, what do we say? You should care for your children, nurture people, and all that. And you will see it if even you are a doctor and you are riding your car, a policeman will stop you, and the next thing is that your husband's car? Oh, yes. What is the idea behind it? People think as a woman, you can't get to those positions. So culturally, we are inclined in that direction, right? The old-fashioned traditional system that is playing us is still existing. So let's take nurses, for instance. We form the majority, and we will say it's a female-dominated profession. But just cast your mind around. How many nurses are in higher decision-making bodies? Committees, policy makers, where are they? We are not there. The doctors are lucky because they had more men there. But when it comes to the women, nurse for the somewhere, right? You nurture, you should be at the lower levels for the men to take decisions for you. So we need to see the way to find our X and get to the higher decision-making bodies and then policy makers. You know, women can multitask. Women have other diversities. Oh, sorry, oh. Yes, I'm not stereotyping men, right? But women have the ability to analyze things towards the least level that you can think of as a man. So we are saying that add that to what you are doing, and we are going to bring diversity to the decisions that you are making. It wouldn't be a man, right? To make it right. Please, are you here, the men? And I know the married ones can attest to that fact, right? You go and take decisions, we say it, you won't listen. What will happen? It will bounce back, and what? You will come back to us. So that's a typical example of how we are running our country. We need women in those decision-making areas. We need women in those policy-making areas, right? So that we can have a very good healthcare system. All right, so we are saying that these structural barriers, and we have the gender biases, and no mention the work-life challenges, women. Right? Right? And then we have this organizational cultures that favors what? Men. So there are some of the realities that we see. And then we are saying that if we don't add women, it will lead to reduction in the diversity of perspective in healthcare decision-making, innovation, emergency care policies, system-level reforms, and organizational performance. So the diversity in policies will be one way, right? There will just be only men's perspective, right? So closing the gender gap is critical to enhancing equity and quality in emergency healthcare delivery. So I think I've mentioned why we need women in leadership roles. So they are going to bring diverse perspective and leadership styles, strengths in relational leadership. And women are very effective communicators. So you need us there. And then gender equity is going to influence organizational culture and patient outcomes. And we serve as role models and mentors to our genius, right? So women in leadership role is going to make people who want to take leadership positions, right, to also come in. So we serve as role models and mentors to the junior nurses who have interest to become leaders. So you need us there to help in bringing or building strong emergency setting. Eno mentioned a lot of the challenges, so I'm just going to run through it. So the biases and the stereotyping, the glass ceiling, organizational cultures, right, that undervalue women's contribution. And then she mentioned the work-life balance challenges. So you're supposed to be on duty and you're a woman, you have a child. The person who's supposed to come in to take what? The baby so that you can come to work calls and tell you that I have an emergency so I can't come. That's what is happening. And then Obiaoye in charge. I use certain good examples for people to follow. Right. So what happens? The women we are here, we tend to be explaining ourselves, right? For people to see that it's not intentional. So it affects our leadership roles as women. And limited training and skills in what? Leadership are also challenges that we see. So what is the way forward? We are still finding our X. How do we get our X? Right. So we should implement targeted leadership development programs. So there should be workshops, training, simulation, inclined leadership training for women. Right? And Eno mentioned the mentorship, the sponsorship, and leadership development program for women so that we get the skills, the knowledge, right, and the appetite to enter into leadership. And then we want to have better flexible work policies and family-friendly practices that accommodate what? Work-life balance. All right, so how do we get this? So some people have given birth, they need to come to work, and they have this policy there. You can work for what? 4 hours. And you choose the convenient time. So it's a way of making flexible work schedules for women. And then we want to promote organizational culture change by encouraging gender equity policies. Right? So, enye mema nkwa no betimi ahodi. So ye fa oba ba akwa, ye mfa be ma ba akwa, oye de capable. So we are talking about gender equity. Please don't leave us behind. And then creating transparent recruitment and promotion processes, right? So promotion, it should be transparent because you are a woman. Promotion, about your highest leadership position. So what happens? You are not promoted. So please, it should be transparent recruitment and promotion processes for all women. And inclusion of nurses in emergency care governance and policy making. And we don't see nurses there. I don't know, it's because of where I'm coming from. And you see some of our medical professions in some leadership and policy making positions. And then when you go through, there are no nurses there. You will just wonder, there are no nurses there. So I think it's high time we place nurses in these decision-making bodies in order to have a synergic emergency care system in Ghana. But before I conclude, you know we have some saying that say that it's a man's world. Do we agree? They say it's a man's world. But there is another song that says, women, we run the world. You know that song? So where do we run the world? Where? Where? Because we are saying it's a man's world. And then there is another one saying, women, we run the world. And when you see us dancing in that manner, but when it comes to leadership, the men are running us. So there should be mentioning. There should be a call towards action. So I'm not saying affirmative action, but at least we should do something about it. And then moving forward, or women getting into leadership roles should be intentional at this level. It should be intentional. We can't sit down for it to happen. We should be intentional about it. And we are talking about mentorship, creating opportunities, making ways for women to have work, family balances, and all that. So we should be intentional about that so that we can have a very big community with women. And as I said, our perspectives are always relevant, right? But now we have a woman who is a vice chancellor, right? That's the highest we've gotten so far. So, oh my, vice president as well, right? Yes, vice president. And then the vice chancellor is a nurse. So the nurse, yes, she's a nurse. So the nurses here, this is a challenge to you, right? Yes, so let's try to move up the academic thing, get to the higher places, and try to assume those positions to help in the care of our patients. So in conclusion, women in leadership roles drive transformative change in healthcare by enhancing equity and strengthening systems through inclusive policy and diverse perspective. So addressing barriers like gender bias and underrepresentation empowers more women to lead, and is going to foster innovation, better workforce, retention, and equitable care delivery. Eno mentioned her call to action. My call to action is join the movement. How do you join the movement? As women in emergency care, right? Mentor one woman in emergency care. Either in EMT, either in nursing, and either in medicine, right? Administrate, mentor one woman, right? And advocate for family-friendly policies in the hospitals for women. Because we know this is one of our biggest challenges as women. And then please crave for gender equity. And if we do this, your actions is going to transform women in leadership roles for generations to come. If we take this call to action, mentor somebody, advocate for family-friendly policies. And the last one is, please, in the context of gender equity, and and is going towards transform women in leadership role to the highest level. Thank you so much.
Thank you very much, Ms. Into. A call to action, join the movement. So our last presenter is Christiana Boatima, also known as Para One. She's the first paramedic and first female paramedic in Ghana. She's the head of monitoring and evaluation at the National Ambulance Service and has an MSc in disaster management and monitoring and evaluation. So please welcome Christiana. Para One.
Thank you very much. Good morning. Okay. Thank you very much once again. I'm speaking on the empowering women in pre-hospital care. We are looking at the perspective from the paramedic. Okay, so we are taking that angle too. We have looked at the medicine, the doctor's perspective, the nurses. So we are looking at those of us who are outside of the hospital. So we have seen a lot of women who have done great things. One of these women is somebody named Clara Barton. I don't know whether you have heard that name, Clara. She is an American. During the American Civil War, she was a nurse. She gathered people, soldiers, and she was providing food, care for them. It wasn't only food. She also provided medical care to them during the Civil War. And she later formed the American Red Cross. That was a woman. There is this other woman, Maria Marvin. I don't know whether you have heard that woman's name. She was in aviation. She is a French woman. She was in aviation. As for her, she was flying and plane. She was one of the very first women in the world who received a pilot license. She was a woman. And she was flying balloons, airplanes, and she designed the very first air ambulance. And through that her design, we have air ambulances. So you can have air vac, moving patients from one point to the other. She was a woman. So it means women, we are also there. We can also do something if we are given the opportunity. We can do great things. These are just two women who helped the pre-hospital care system. Okay, so through them we have the emergency care. So if you give us a chance, you give us a chance and see what will happen. If you give us a seed, you multiply it. Eh? You multiply it for you and we will do great things, okay? So these women prove that EMS needs skilled professionals, regardless of the gender. It's not only the men. The men are doing it. We can also do it and do it better. Okay. So who is a paramedic? A paramedic is somebody who works outside of the hospital. We manage health emergencies outside of the hospital. And we transport these persons, provide them care, and transport them to the facilities where they receive continuum of care. So that is what the paramedic does. That is what we do. We work on the ambulances. Okay. We make quick medical decisions during emergencies because we have to think very fast, assess the patient quickly and know what is wrong with the patient, and then not just transport, but intervene, provide some interventions before we hand over at the facility. If we don't do anything and you just bring the patient to the facility, the care at the facility will not be smooth. Because if the patient is able to receive some basic first aid before they get to the facility, their conditions will not worsen. So the facilities will not have higher advanced interventions to be doing more if we are able to provide our care better. Okay, so that is what the paramedic does. You realize that these things that we are talking about, we need physical readiness, clinical competence, quick decision making, psychological strength, and then teamwork. These skills are not gender specific. It's not only for the men. Okay? So if you bring the women on board, we can also do it. It reinforces that women belong fully to this field as well. But let us look at what is happening, the current status. We have low representation across, from local to global. In the US workforce, EMTs, who are women, they make up 35%. Paramedics women make up 23%. Approximately 15% of the women in the workforce, the women there in leadership roles, are just 15%. But look at Ghana, our total population. Women make up 50.1% of the total population. But when it comes to leadership roles, you don't see a lot of women there. Why? Let's come to NAS. We are looking at it from the perspective of the paramedic. Look at the National Ambulance Service. We have a total workforce of about 3,300. Out of that, 26% are women. 74% are men. In the service, we have category of workers. So we have support staff, we have paramedics, we have health tutors, we have advanced EMTs, we have intermediate EMTs, we have EMT basics. Each of these categories, if you can look at the graph, women are lowly represented. Let's move to the top, the very top, headquarters, the very top position, administration, top management. We have 36% of our top managers being women. We are also lowly represented. Let's move to the regions. We have 16 regions in Ghana, and each region we have one administrative manager, a regional boss who is overseeing the region. We don't have any female who is a regional administrator. We have their deputy. So for the region, we have an administrative manager and a deputy. So for the deputies, we have also 16 of them. Out of the 16, we have 2 being females. So when you put all the administrators and their deputies together, we have 36. And out of the 36, we have only 2 representing 6% being female when you come to the regional level. This is the same picture you will see when you go down to the districts. So the women, we are lowly represented. The challenges have been mentioned and have been explained, so I will just go through them. So we have the glass ceiling, as was mentioned. Is it that when somebody wants to join the EMS profession, the person may be asking himself or herself, if a lady, okay, so do I see any woman up there that I can envision, dream to be? So if I want to take this profession as my profession for life, where will I get to? Will I be able to climb the ladder to the very top? But for now, we don't see anybody there. So would I encourage the young women to join the service? So that is a challenge. That may be a reason why we don't have a lot of women in the service. We have the maternal wall. So if we recruit more women, they are going to deliver. Most of our women, they are in the reproductive age. So if you pick them, you recruit them, they will deliver. They will get pregnant, right? And that one is 1 whole year off, right? 1 whole year, you won't see the full effects of the person. Because 9 months, then you deliver. You go maternity leave. After maternity leave, you have to take your leave, 1 year leave in addition to that, you can take care of the baby. And that one is depriving the work of your full services. So is that the reason why we are not seeing a lot of women in the service, because there is this thing that EMT work, it's for the men. But it's not for the men alone. The women too. It's not only for lifting and moving. Do you understand? We can ask the patient relative to assist us to lift, right? We can help the men to lift, but we won't lift alone, right? We can take care of the patient. So we should be encouraged to join the service. The workplace culture. Do we have the facilities that we can say that, okay, women can have their own crew room, and then men will have their own crew rooms? We don't even have the facilities. So how do we even demarcate and dedicate rooms specifically for women? That is another challenge. So if you send 9 women to one station and you add men to the station members, where are they all going to fit when they go for 9 duties? Are they all going to share the same room as their crew room? That is another challenge. So those are some of the challenges that we are seeing. Why do you think that female representation is good or is even important? The earlier speakers mentioned we are good communicators. Women, naturally, we have that. God gave it to us. You can't take it away from us. And some patients need that. So that is something that is good, okay? So So data indicates that female staff significantly reduce treatment refusals. We can talk to the patients to accept care. Do you understand? As for the guys, they are just boom, straightforward like that. If you don't want, then you sign a refusal form and then we are good to go, right? But the women are not like that. They will be able to speak to convince the patient to accept care. Studies also show that women are often better recognizing non-traditional stroke symptoms. And when you are dealing with obstetrics and pediatric patients, when there is a female caregiver, the anxiety level of the patient goes down. So it is good to have females on the team because they will help. They will calm the patients down, okay? So please, have more women in your team because it's going to improve the outcome of the patient. How do we empower women? How do we bring them on board? What strategies can we put in place to ensure that we have women and then they are equitably represented? Okay, so we can do targeted recruitment. Targeted recruitment. Can we say that, okay, we are giving a quota to women for a particular year recruitment so that we can have more women on board? Can we also have structured mentorship for the young ones who are coming up, so that we can mentor them? Can we have gender-specific infrastructure when we are building the stations? Can we look at having separate crew rooms for our leaders, our females, and for the men? Can we look at that? Can we look at the maternity, the policies that are governing the maternity leave? When the woman returns from maternity, are we expecting the woman to move straight and provide the same number of hours as the man, knowing very well that the woman has a small baby, a young one to take care of? Can we look at some policies that can be flexible to have the women on board so that they can also still provide care, their services? Can we do that? So we should create the equity, not equality, not just equality, but equity. There should be fairness, okay? We are many in the population, so we should be able to put our policies in place so that we can be able to pull more female into the profession. So policy reforms is a backbone of cultural change. We must move beyond tolerance to active inclusion, okay? We should have clear, enforceable consequences for sexual harassment and discrimination so that the women, the females, can be protected. We should implement light duty roles. Can we look at it, put some women at the dispatch? Can we put some women at the training so that they will be doing more training for others? Because that one, you'll be able to merge, combine the family and then the work roles. And you'll be effective, right? Can we create some reporting mechanisms where staff, female staff, can speak up about bias without fear of retaliation? Can we look at these things so that we can help our women feel safe in the profession? So we can give them supervisory roles. We can put them in the training and education roles. We can do some administrative roles for them, and then coach and mentorship opportunities so that we help bring them up. This woman, Lieutenant Esinam, she's a Ghanaian. She led U.S. peacekeeping. She led a platoon. She was a leader. So in Lebanon, she led the platoon, the whole team. And they were able to do their work successfully. Okay? So these are some of the women who have climbed up and then given the opportunities, and they excelled. So please, test us and see. Yes, test us and see. Okay? So representation strengthens EMS. Equity supports retention. Leadership pathways must be intentional. We must intentionally put things in place to help the women also climb the ladder to the top. Okay, so let us commit to these goals at this conference. Thank you very much.
Thank you very much, Para One. Okay, so we'll have a short panel discussion. So we'll have our panelists, our presenters come forward, and then we'll take questions. No, so the panel discussion is to take questions from the audience. But before you say it, then I'll ask mine before you ask yours. Hey, please, I have the mic, so I will start. Oh, no, we want women to ask them, where are the men in front? Hey, where are the men rather asking the questions? Hey. Okay, so we'll take about, we'll take the question in batches. So we'll take 3. So we'll take the first 3, and then our panelists will talk, and then we'll take the next set of questions. Thank you.
Okay, good morning. Mine is not a question as such, but it's just a contribution. Can you hear me now? Yes. Okay. So I like that Para One spoke about sexual harassment, but it was just a dot in the wide range of things that happen to female emergency physicians and females across the divide. And I want us to talk about it because it affects safety. And one of the things that when you walk around your workplace and you don't feel safe, you want to leave the place. And in our setting where there are lots of junior colleagues, you would see that, especially with where national service people come there, you realize that there are small kinds of sexual harassments that happen. And as they are happening and nobody is doing anything about it, it becomes big. And so I want us to hammer on it and try and let people know that it is happening. You are there, patient relative comes to touch you at a certain place just to talk about something, and these things are happening. So please, let's talk about it as well.
Thank you very much. That was a nice presentation. Kudos to all the presenters. Mine is a suggestion to the movement. I'm saying that women, let's support ourselves. Are we really supporting ourselves? Because we find one member in an executive committee, then there is this lady who is doing well, and then people are not trying to support. So let's push. In our account adage, you have something like your food, your pan, your piano. So let's support ourselves. So as part of the movement, I say women for women. So if there is a place, there is a vote, you see that the women are supporting the men. And there is one lady in it, nobody is voting for the lady. So please, women for women, let's support ourselves. Thank you.
Thank you for the opportunity. So my question is that, what are we doing about the idea that, obadi or kohwa ninyon koba bekchino assign? You know that thing that we have. And it's not as if the women don't want to get there. So you go to school, fine, you just have to get all these leadership roles in you, alongside a certificate. So you go to school, you are not promoted. Meanwhile, you also want to get there. What are the leaders doing about it? Because it's really a problem. Thank you.
So we'll let our panelists answer these questions, and then we'll take the next set. Thank you.
Women, we have to be kind to each other. I saw something on TikTok just a few days back. I said the enemy of a woman is another woman. I just saw it a few days back. Let's learn to be kind to each other. You're at work with your colleague. You know that she has a family emergency. You're at work with your colleague. You know she has a family emergency. Something has suddenly come up. Be kind to the person. Take over some part of her shift. Allow her to go and solve the problem and come back. But you hear our own women saying, this woman is very lazy. Every day she has one story after the other. We have to learn to be kind to each other and support each other. As for the sexual abuse bit, it exists. But even when a committee is set up, it's made up of men. Only one woman will be on the committee. And at the end of the day, they will just say that the woman was even playing with him, taking money from him. We have to be intentional about getting into leadership positions. And we have to be kind to each other and be kind to ourselves as well. If you are not kind to your fellow, nobody will be kind to you. And when the men realize that we are intentionally being kind to ourselves, they are going to support us. But I feel another starts here. It starts from the women before the men will get involved. So please, let's learn to be kind to each other, and the men will help us. Thank you.
Yeah. And then women supporting women. I think we should start now. The change should start from us here, right? So let's have a change of mind and support each other. With sexual harassment, I think as a leader or as a woman, you should set boundaries. Right. And the point is, you see a man starting something, and we encourage it to some extent. So set boundaries. Know where the friendship ends. And when you travel outside, even when you see a woman and you say, hey, shh, beautiful, it's sexual harassment. You can't do that. You make her uncomfortable. Look at her shape. Look at, it's sexual harassment somewhere. let alone touching a woman's butt, right? And you can't be hugging a woman who is your friend in some jurisdictions because they've set boundaries. So as a woman in leadership, set boundaries. Know where the friendship ends, and then I think you are good to go. If you are sexually harassed, let somebody know about it. Don't be in spaces that is so close for comfort. You have a man who is visiting you and in your office, and you've locked the door. Right? Yes. So you have to, wherever you find yourself, if you are meeting a male counterpart somewhere, it should be in what? In an open space where people can walk in. So we should look at all these things to prevent ourselves from getting sexual harassed.
Okay, I will just add that we should also report. Okay, so sometimes the harassment, we are harassed and then we keep it to ourselves. Just inform our friends. We should report to the authorities and see what they can do about it. Okay, that to be set. But if you feel that reporting will also lead to some form of stigmatization, you will not report. But please, let us report and let us support each other as females so that together we can see ourselves at the top. Otherwise, always we will just be in the middle and then we'll be down there. Thank you.
Thank you very much. And I think in addition, our HRs of our various institutions should have regular presentations and training programs on sexual harassment. Some men think what they are doing is just being nice or being fair. They don't know it is sexual harassment. Genuinely, they don't know. So probably if we have more training programs, training sessions, as you drum it into their heads, they will know the boundaries that they can't cross. And that will help to reduce that. Thank you very much, our panelists. We'll take our next set of 3 questions.
All right, thank you. I think as for the glass ceiling, it's good that it's just glass. But that one, you can just break it. But my question is specific to, I think it was 3 questions, but one has been answered already. So the first one is to Dr. Eno. There's a stage that there is, as for women, they lack emotional intelligence. And we all know that emotional intelligence is the synonym of leadership. So I don't know whether you agree with that assertion that women lack emotional intelligence. Then this one is for para 1. You said something about physical readiness. At my AD, we are all men, only 2 females. And I went to the matron to say that we want males. You see, the physical readiness we are talking about. So, for example, when you are doing CPR, the women say they don't do CPR. And in that regard, I let one day, you see, they did it and we saw that CPR within 1 minute is not easy. So if the women who say a man is under 1 minute, if they do CPR within 1 minute, that's where they will know that 1 minute is very long. So 1 minute is very long. So I wanted to know. So in that regard, that's why we want more men at the ED. But I'll try and change that assertion. Thank you.
Thank you very much. I think my question was somehow addressed, but I'm going to twist the question this time. It is always said that women in leadership suppress their fellow women. Whether it's true or not, I want you to tell me. Then give me the reasons why women, when they get to leadership position, try to suppress other women under them, preventing them to climb up to their level. Then the second aspect is on the sexual harassment. And for men, the first time I was given the definition for sexual harassment, I was careful. And so, men, please go and find out the definition for sexual harassment. I tell you, when you understand it, when the woman tells you stop, you won't do it for the second time. Because if you even hold the hand of a woman and she says stop and you go on the second time, it's sexual harassment. So please, let us go and understand that definition. And some of these bad things that happen in the office environment will stop. And sometimes it goes beyond, the person is harassed, she tries to make the complaints, and then they try to post her to unfavorable conditions, try to transfer her, put her under very poor and harsh conditions, worsening the case of the woman. Men, please, women are ours. Let us treat them with care and let them expect the best from us. The first time my wife left me, that was when I understood the importance of the woman. Yes. And I went to bed healthy. Just around 12 a.m., I woke up, I wanted to drink water, and I was paralyzed. And from that time till at about 2 p.m. afternoon, it took a woman to say that I haven't seen Jerry for the whole day to walk into my bedroom to see what was happening. That was my savior. So please, let us treat women fairly. They are good. And if you give them the opportunity, they will give us the best. Thank you.
I agree with this man, what he just said. My mother is dead and gone, but I still remember her. So, if you're able to meet a good woman, not just a woman, a good woman, they are wonderful. Without them, men can't do anything. So my first question is, you did mention a whole lot of women in position now across the world. So the question is, have you done any research to find out how they got there and why? Were they lifted or they worked through the line to those positions? Number two, this is in relation to nursing. Nursing in leadership position. I visited a number of nursing training institutions. So I'm challenging you to conduct a research in those nursing training institutions. You know, when you take the gender in nursing colleges, women are far more higher than the men. And ask yourself whether those women in those institutions want female principals to lead them, and why. And the third one is women, we have two words here, readiness and maturation. So the question here is, are women matured for leadership positions? And are they ready? And of course, the last one is female leaders in position now. What have they done intentionally just to lift up their colleagues in those positions? Thank you.
So let our panelists answer the question before we continue.
I'll start with the gentleman that mentioned that women lack emotional intelligence. I just checked. In fact, research generally suggests that women tend to score slightly higher in overall emotional intelligence and certain specific components compared to men. So please, you have to do your research again. Women have more emotional intelligence than men. I think somebody talked about women suppressing junior colleagues. sometimes it becomes a speculation. And people will not look into it. When a woman is up there, it is assumed that she must be wicked, inconsiderate, selfish, all the adjectives that you can think of. So your junior colleagues may not even come and tell you their problems. Let me give an example. I'm the lead clinician of Confanoche Accident and Emergency. I was there when one of my friends, a senior resident, a gentleman, came to tell me that he found one female resident crying somewhere in the corner, that she had problems, that she had to discuss with somebody. But she had been told that she should never try and come and tell me any of her problems. Because when she comes, she's going to have it very... So when she told the gentleman, he told her that, oh, it's not true. She's the one that is going to help you. Go and tell her. So he held her hand and brought her to me. And then we solved the problem together. So most of the time, it's a speculation about women. It's your fellow women who may start it, and the men may join in. So now that we are learning to love and support each other, please, let's try and help our fellow women and our other colleagues when they need assistance. And be intentional about helping your own fellow women. Because we all heard about the barriers, the glass ceiling, the social expectations, and the others. As for sexual harassment, if we want to talk about it today, we are not going to end. So like Hetty already said, let's keep having our own barriers and be careful about the things we do with our colleagues and others. Thank you very much.
And with the CPR, I think that it's not only CPR, we have to build stamina. So encourage your other the female colleagues to exercise, to build stamina, so that during such strenuous interventions, they can also add their support. Because if you should leave it to only the men, they will also get tired. And if you don't have a lot of men around, then the intervention will not be effective. So let's encourage them and then give them more training, refresher trainings. And I think that will help. Thank you.
Yeah, let me add on to the CPR. I think in Ghana, women think some jobs are for men, especially when it comes to CPR. In our area of work, we see that happening, right? Women think we have the men, so we should stay behind. And the women will also say, when it comes to cleaning the patient, we do it. You men, you don't want to clean patients who have soiled themselves. But I think it should change from now. We've all been trained in CPR, right? We know the techniques. It's not really about the strength, right? It's about how you deal with it. So women, if we want to take these positions that we are talking about, I think we should try, and because we've all been trained. So let's change our perception that CPR is what? In the jurisdiction of men. Then with emotional intelligence, we learn to be emotionally intelligent. So if you want to get to leadership position, know something about emotional intelligence. Know what makes you tick. Know what makes you break down. Know what makes you, I don't want to use the word misbehave, right? Get out of control. And you deal with it if you want to become a very good leader. And then with women suppressing other women, I think it's not our trait, but it's been learned in the society that we find ourselves. So, Oba, you take your position, it was all hard. And yes, I'm a man, so because of that, we go the extreme way in doing it. So as we are talking about women in leadership, these are the things that we should think about. And